Assalamualaikum. We are going to present to you the application of synthetic polymers, which is pharmaceutical application in pill coatings. Let's get started.
First thing first, let's talk about the differences between natural and synthetic polymer. The first difference is natural polymer can be found naturally in environment, but synthetic polymer is produced artificially by humans. More than that, natural polymer can occur naturally, but the synthetic polymer do not occur naturally. Natural polymer is produced from biological processes, but synthetic polymer is produced from chemical processes. And lastly, natural polymer is easily degraded, but synthetic polymer is hard to degrade naturally. So, pill coatings is produced from synthetic polymer.
The first application of synthetic polymers is controlled drug release. Cellulose acetate phthalate, or CAP, is a semi-synthetic polymer used in pharmaceutical coatings. It is derived from cellulose, a natural polymer made of D-glucose units, and is modified through a condensation reaction. In this process, acetyl groups from acetic anhydride and phthalate groups from phthalic anhydride are added to the cellulose backbone. This modification gives CAP special properties, which is it is not cross-linked, and its functional groups make it insoluble in acidic environment like the stomach, but soluble in alkaline conditions such as the small intestine. This pH-dependent solubility makes CAP perfect for enteric coatings, which are used to protect drugs from stomach acid or to reduce irritation caused by the drug in the stomach. Once the coated pill reaches the intestine, where the pH is higher, the polymer dissolves and the drug is released. So, CAP helps in controlled drug delivery, ensuring the medication reaches the right place at the right time.
Now, let's talk about an important application of polymers, taste masking. Many drugs, especially those used in pediatric and geriatric medicine, have a very unpleasant taste. To improve patient compliance, we use a strategy called barrier formation using polymers. One common example is the use of acrylic polymers. These are synthetic polymers made from monomers like methyl methacrylate and dimethyl aminoethyl methacrylate. They are formed through free radical polymerization and are typically not cross-linked. The structure contains ester and amine functional groups. They are insoluble in neutral pH, which is important because it means they don't dissolve in the mouth, where the taste buds are, but will dissolve in the acidic environment of the stomach. This forms a protective barrier around the drug, blocking its bitter taste until it reaches the stomach. As a result, it makes medication much more tolerable, especially for sensitive groups like children. So, acrylic polymers play a key role in making medication both effective and more pleasant to take.
Let's begin with cellulose acetate phthalate, or CAP. It's widely used in drug coatings to protect medications from stomach acid, which improve drug effectiveness and reduce gastrointestinal side effects, greatly benefiting patients. Economically, CAP lowers healthcare costs by making treatments more efficient and extending drug shelf life. Environmentally, it helps reduce drug waste and contamination, since CAP-coated drugs often need smaller doses, meaning less receipt in wastewater. Now, moving to acrylic polymers, these are incredibly useful in creating customizable therapies. Their flexibility allows scientists to adjust how and when drugs are released, tailoring treatments for specific conditions. They also protect drugs from moisture and pH, helping reduce spoilage and waste. Plus, some acrylates have built-in antimicrobial properties, which means fewer toxic additives are needed, making them a safer, more sustainable choice for the environment.
So, the conclusion is, pill coatings made from synthetic polymers are essential in modern pharmaceuticals. They serve multiple functions including improving drug stability, masking unpleasant states, enabling control or target drug release, and enhancing patient compliance. By tailoring these coatings to specific needs, pharmaceutical scientists can ensure that medications are more effective, safer, and easier to take, ultimately benefiting both patients and the healthcare system.